It's important to understand that risk can be compounded. We got the risk associated with IVF. Then you got the risk associated with using donor eggs or donor sperm, and the risk associated with having a multiple pregnancy. All of these risks can be compounded. So if you are somebody that has 2 or 3 or 4 of these risk factors, then the pregnancy risk is much higher.
This leads us to the very commonly asked question. How do you answer this, Dr. Garcia? Are IVF pregnancies at a higher risk of complications, and why?
Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're 2 of the physician leaders at Markham Fertility Center, otherwise known as Our Baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together. Welcome back. Today we're going to be talking about IVF, and in particular, risk to IVF. Lots of patients ask, will my baby be healthy if I do IVF? Will I get cancer from IVF? Will my pregnancy be high risk? What can this do to my health? Today we're going to do a deep dive and answer all of these questions. And don't forget to go back to episode 14, where we talk about what IVF is, what is the stimulation, how does it work, so that you have a really good foundation as we talk about the different risks associated with IVF in this episode.
IVF and the risks associated with IVF, it's always a timely topic. This is something that comes up in the media not infrequently, where somebody will make a comment about IVF or the risks associated with IVF. And so recently, Beverly Hills 90210, for all the Gen Zs out there, Shannon Doherty, she publicly stated at some point that she felt that undergoing IVF contributed to the fact that she eventually developed breast cancer. And so very timely to talk about this.
All right. We are going to divide this episode today into different categories. We're going to talk about the risk of IVF to the egg producer that is associated with the stimulation and the medication. Then we're going to talk about the risk to the egg producer that is associated with the egg retrieval procedure. We're also going to talk about the risk to the pregnancies that are conceived via IVF. And then we're going to talk about risk to babies who are conceived through IVF. We're dividing that into 4 different categories.
First up, risks to the person who's producing eggs from the initial part of IVF for the medications and the stimulation. So just a little primer here. As we talked about in episode 14, IVF, the first step in any IVF cycle is stimulating the ovaries so that they produce a bunch of eggs at a time. Generally, we're aiming for about 10 to 15 follicles, but of course, this is going to vary a lot depending on somebody's ovarian reserve. In order to stimulate the ovary, to do this, we're giving injectable medications called gonadotropins. These are synthetic versions of hormones that are naturally produced by the brain, and these hormones are FSH, or follicle-stimulating hormone, and LH, or luteinizing hormone. In an average IVF cycle, somebody may be on these injection medications, maybe taking these hormones for about 10 to 12 days. And what we see is that the estrogen levels will go up as people are taking these medications, as more eggs are being produced.
There was a Cochrane review on the risks of cancer associated with fertility drugs that looked at all the studies and all the evidence available up until 2013. And it specifically focused on the use of ovulation-inducing drugs such as Clomid and the gonadotropins, which are the synthetics LH and FSH Dr. Wise was talking about. Before I tell you about the findings of the Cochrane review, I need to tell you what it is. The Cochrane review is a high-quality, comprehensive analysis of all the available evidence. Imagine you want to find whether a certain medication is safe and effective. Instead of just reading 1 or 2 studies, or if you're going to buy a product and you read the reviews, instead of reading 1 or 2 reviews, a Cochrane review basically looks at all the studies that have been published, and then you get experts to analyze this collection of studies and draw conclusions based on multiple studies as opposed to 1 or 2. It is systematic, which means that it's a particular process that the analyzers go through to come to the conclusions. And it is comprehensive because it looks at very high quality research. Studies that are not high quality get excluded from this. And it's also reliable because they're looking at independent experts who use very rigorous material to minimize bias and errors and come up with conclusions. So now that you know what a Cochrane review is, let me tell you about the results of a Cochrane review that looked at the effects of fertility medications and the risk of cancer. The study broke the risk into ovarian cancer risk, breast cancer risk, and other cancer. In this review, the analyzers looked at 182,972 women and found that there was no significant increased risk in terms of ovarian cancer with the use of fertility drugs, including Clomid, letrozole, and the gonadotropins.
The largest study within the review included over 25,000 women with an average follow-up of 21 years where they were looking at breast cancer risk. In this study, they found no increased risk of breast cancer in women who underwent IVF with those gonadotropins compared to those who received non-IVF fertility treatments. Interestingly, the study observed that women who underwent 7 or more IVF cycles actually had a lower risk of breast cancer compared to those who only underwent 1 or 2 cycles. There was a small number of women who had 7 or more cycles, and the reasons for this finding remain unclear, but it's definitely interesting.
Yeah, and we're not claiming that you should have 7 cycles of IVF to reduce the risk of breast cancer, but it was certainly reassuring from the study that doing multiple cycles does not increase your risk.
Mm-hmm.
They also looked at other types of cancer, such as thyroid and skin cancer, and again, it found no significant increased risk.
They also looked at endometrial cancer. Endometrial cancer is sometimes called uterine cancer, and it's a cancer of the lining of the uterus, of the thing that gets shed every month when a woman might have her menstruation. The studies within the review did not find an increased risk, but those studies were also really small, so that Cochrane review did not actually make any official conclusions about the risk of endometrial cancer and the use of IVF medications.
So there you have it. A Cochrane review is what is considered in the scientific community to be the highest level of evidence for the reasons that I discussed before, and looking at ovarian cancer and breast cancer in particular, as well as other type of cancers. There is no evidence that fertility treatments, whether it's gonadotropins, letrozole, or Clomid, increases the risk of any of these cancers.
There was another article that was published in Fertility and Sterility in 1997 that looked at ovarian cancer in some great detail, called Infertility, Fertility Drugs, and Ovarian Cancers, a Case Control Study. In this particular paper, they were trying to look at the risk of invasive ovarian cancer amongst infertile women who were treated with fertility drugs. Some of the key findings from this paper showed that nulliparous women, or women who had never been pregnant, actually had an increased risk of ovarian cancer compared with women who had had pregnancies, and the risk was about 1.5 to 2 times greater.
Also, infertile, untreated nulliparous women had a higher risk of developing ovarian cancer compared to non-infertile nulliparous women. So to say this another way, it looks like it is the actual infertility as opposed to the not having children that increases the risk of ovarian cancer in this study.
Mm-hmm. In the study, they also looked at some fertility drugs, and they found that the use of fertility drugs did not increase the ovarian cancer risk amongst women with infertility compared to women with infertility who were not treated.
It appeared that infertility itself was associated with an increased risk of ovarian cancer among women who were nulliparous, and the increased risk was about 2.7 times compared to women who did not have infertility. Women who had children, periods of infertility did not increase the risk of cancer, and there was also no association between the duration of infertility and the risk of ovarian treatment, and there was no association between the type of fertility medication and the risk of ovarian cancer.
All in all, in this study, they concluded that not having any pregnancies or nulliparity increases the risk of ovarian cancer, and infertility without any kind of further medical treatment may actually further increase this risk. That being said, women who were treated with fertility drugs did not have a significantly increased risk of ovarian cancer amongst women who have infertility. So these results really suggest that infertility treatments are not a big risk factor for ovarian cancer.
To be honest with you, as I was researching this, I struggle a little bit because I do not want to tell our amazing warriors that just because they have this condition they didn't ask for, they are increased risk of ovarian cancer. But of course, we're here to provide evidence and to share knowledge. And that is what the study suggests. However, I think it's important to put it into context. The baseline risk of ovarian cancer is about 1 in 70 women at age 70 will have ovarian cancer. It would still be a very rare condition to have ovarian cancer from infertility, so I don't want to over-worry people who are already struggling with this condition. Whether you're doing IVF once or twice or 7 times, and whether you're doing multiple cycles of clomid, letrozole, gonadotropins, I think it's very reassuring to know that the treatment that you're using to treat this condition does not increase your risk, which I think is something that's in people's mind a lot.
Absolutely. I think you're totally correct. On the flip side, I think knowledge is power, right? And so knowing that you may have certain things that might put you at a slightly higher risk will also help you be a bit more in tune to the rest of your health and in tune to certain symptoms that you may experience that may make you think, this might be a reason I should go see my doctor sooner rather than later. It's always a delicate balance, but at the end of the day, all we can do is try and manage for a healthy diet and get some exercise and practice good health behaviors, right?
Right. Now that we have debunked the myth that fertility drugs increase the risk of cancer, let's talk about another risk of IVF to the egg producer, and that is the risk of ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome is a condition that can occur with any fertility treatment, but it's much more common in IVF than it would be in IUI. It's almost unheard of in the context of IUI. And it happens when the ovary responds too strongly to fertility medications that are designed to stimulate the ovary productions. OHSS can range from mild to severe. Mild cases are very common. You might get some bloating, some abdominal pain, some nauseas. These symptoms are uncomfortable but generally manageable, and they go away on their own. Severe OHSS is very rare, but it could be very serious as well. This is when you have rapid weight gain, severe abdominal pain, vomiting, shortness of breath, fluid in the abdomen. This would require admission to hospital. Sometimes it requires drainage of the fluid, and it's a condition that needs to be monitored, but it usually leads to very good outcomes when it's properly assessed and monitored.
So super important to highlight that severe OHSS, the kind that makes people really sick and end up needing to go to the hospital, is really rare. And there are studies to back this up. Mild OHSS happens in about 20 to 33% of IVF cycles. Again, mild bloating, maybe a bit of nausea, but severe OHSS only occurs in 1% of cases. It's an important risk to be aware of, and it's something that you should definitely talk to your doctor about if you're experiencing these symptoms, but it is definitely not something that happens to most women undergoing IVF. The really important thing, though, when we're talking about OHSS is that we have great ways to reduce somebody's risk of experiencing severe OHSS. 20 plus years ago, it used to be way more common that patients ended up be admitted to hospital with these symptoms. But over time, we're now using antagonist cycles that specifically allow us to use a different type of trigger medication, which is called a GnRH agonist. And through careful monitoring and then using some other medications that we add on to the cycle, we're able to significantly reduce the risk of severe OHSS and to mitigate the symptoms if somebody's experiencing them.
Now that we've talked about risk to the egg producer from the medications, which we know is none, and risk to the egg producer from the stimulation, which we talked about OHSS, now we're going to talk about risk to the egg producer from the actual procedure of the egg retrieval. As you know, the egg retrieval is a crucial process in the IVF cycle. It involves using a needle to extract the egg from the ovaries. This is guided through ultrasound. Marking Fertility Center, this is done under sedation with the help of an anesthesiologist. This procedure is very safe. However, nothing in medicine is without risk. Some of the risks associated with the egg retrievals are bleeding, infection, and injury to the surrounding organs. According to a study published in Human Reproduction, the absolute risk of these complications is estimated to be less than 1%.
Whenever I'm counseling patients about proceeding with an egg retrieval, I always point out that this is a really safe procedure, and we have experienced practitioners here. We're doing it under ultrasound guidance. If we have our needle, we can see where we're going. Whenever we're doing IVF, the number one goal is always to keep the patient safe. The number two goal is to get as many eggs as possible. Here at MFC, we're so lucky that we have fabulous ultrasound techs who are able to provide great guidance. We also have anesthesiologists present, so we know that all of our patients are very comfortable and are able to manage their sedations and have safe airways.
Having said that, this might be why you've heard sometimes that you've gone a retrieval and the doctor would say, we couldn't get all the eggs because the ovaries were not accessible. And that has to do exactly with this, with the safety and making sure that the complications is less than 1%, as it's in the literature. Sometimes you can see a vessel, sometimes there is bowel on the way, and it's simply unsafe to put a needle through that because it will cost your life. Dr. Weiss is right. The number one concern is the safety of our patients.
Moving on here. The next category to talk about is risks to the pregnant person, risks in pregnancy in an IVF conceived pregnancy. Once we have an embryo and it's now successfully implanted into the lining of the uterus, it's nicely burrowed in there and it's all cozy, there are still risks to consider during the pregnancy itself. And we know that IVF conceived pregnancies do carry some slightly higher risks, and so we do monitor them a bit more closely for these things.
A study published in the American Journal of Obstetrics and Gynecology talked about the high risk in an IVF pregnancy for conditions such as preeclampsia, gestational diabetes, and preterm birth. Another study found that the absolute risk of preeclampsia in IVF pregnancy is about 10% compared to 5% in the general population. Preeclampsia is a condition associated with high blood pressure in pregnancy. There are many degrees of preeclampsia in pregnancy. It can affect the kidneys, it can affect the liver, it can affect the growth of the baby. It can vary in degree of severity, and in severe cases of preeclampsia, it can actually be a life-threatening condition for both mother and baby.
It's important to note that with preeclampsia, as with other medical conditions in pregnancy, careful monitoring is really important. And with careful monitoring, you can often manage these symptoms or syndromes before they become very severe.
There is also increased risk in IVF pregnancy of abnormal placentation, such as placenta previa, which is a condition where the placenta implants right on top of the cervix, and this can lead to requiring cesarean section or requiring increased monitoring in pregnancy due to the risk of bleeding. There can also be placenta abruption, which means that the placenta separates from the lining of the uterus in pregnancy as opposed to at the time of birth when it's supposed to happen. Again, these are things that can be monitored in pregnancy, and this is why some IVF pregnancies are considered high risk. This is why they are monitored more closely, and this is why there are many practitioners that recommend induction of labor at 40 weeks so that the pregnancies can be delivered safely before any of these complications take place.
Pregnancy-associated risks can vary based on the different types of ART that was used. For instance, in a pregnancy that was conceived using donor egg or donor sperm, we know that there is a slightly higher risk of preeclampsia than when someone is using their own gametes, even if both pregnancies are IVF pregnancies.
Maternal age and paternal age are also really important risk factors in the risk of abnormal placentation and preterm birth. So it's not just being an IVF pregnancy, but being an IVF pregnancy in an older pregnant person can lead to increased complications.
Having multiple pregnancies, meaning having twins or even triplets, also poses a much higher risk of preterm birth, requiring a cesarean section, higher risk of preeclampsia, gestational diabetes, than pregnancies that are conceived where it's a singleton pregnancy or when there's one baby growing. Whether it's conceived by IVF or spontaneous pregnancy, we know that having a couple babies inside the uterus will lead to higher risk than having a single baby.
It's important to understand that risk can be compounded. We got the risk associated with IVF. Then you got the risk associated with doing IVF in an older pregnant person. Then you got the risk associated with using donor eggs or donor sperm, and the risk associated with having a multiple pregnancy. All of these risks can be compounded. So if you are somebody that has 2 or 3 or 4 of these risk factors, then the pregnancy risk is much higher.
This leads us to the very commonly asked question. How do you answer this, Dr. Garcia? Are IVF pregnancies at a higher risk of complications, and why?
They are a higher risk of complications, just as we talked about. The why of that has to do with many of the reasons that people are doing IVF in the first place, like we talked about PCOS, multiple gestation, advanced maternal age. This risk can be managed with really good obstetrical care, and the majority of our patients do very well in IVF pregnancies, even if it's high risk. But this is why it's really important to identify these risk factors early on and to get your care managed by somebody who has expertise in this. My patients, when they're graduating, they don't want to leave. They're like, I want to stay at MSc. I want you to follow my pregnancy. And I said, no, no, no. I am the expert at getting people pregnant, but there are physicians who are experts at delivering this pregnancy safely in the context of high risk. Some IVF pregnancies are high risk. Not all of them are. We talked about risk factors being compounders. I've had patients that are relatively young. They got pregnant with their first embryo transfer and everything is well. And these patients are considered low risk. They can be managed by a general obstetrician or either by a midwife, depending on the circumstances. However, some IVF pregnancies are higher risk, and this has to do with other compounding factors like maternal age, use of donor gametes, or multiple gestations. It's important to understand and recognize these risk factors at the beginning so that your care can be directed to the appropriate person to care for these pregnancies. Another thing I wanted to mention when it comes to risk is there are some risks that can be modified and some risks cannot be modified. For example, age, of course, cannot be modified. It is what it is. However, baseline health status at the time of pregnancy is something that can be modified. This is why we always talk about measuring levels such as hemoglobin A1C, measure your blood pressure is under control, make sure that you have a healthy weight going into pregnancy. And one of the reasons also why we almost never want to do double embryo transfers or triple embryo transfers for MSc, because the risk of multiple gestations and how this compounds on top of whatever baseline risk you might have from the IVF procedure.
Now that the pregnancy has implanted and the pregnancy is continuing on as we're moving chronologically through IVF here, we need to talk about the risks to baby and the risks to baby's health and long term if they're conceived via IVF. There was actually this really great study that was published in Fertility and Sterility in 2009, and this was based on data from Ontario, specifically looking at this question. The study was called Risks of Birth Defects Increase in Pregnancies Conceived by Assisted Human Reproduction. This was a retrospective cohort study, meaning that this was a study that used data from the past, looking at a big database covering over 61,000 deliveries right here in Ontario, Canada. And they looked at birth defect risk compared between people who underwent assisted reproduction in some way and naturally conceived pregnancies. In this case, they adjusted for maternal age, smoking, infant gender, gestation, and parity, meaning how many pregnancies that person had had.
The study found that the risk of birth defects in assisted reproductive technology pregnancies, which included ovulation, induction, IUI, and IVF, was 2.9%, versus in naturally conceived pregnancies was 1.86%.
Looking at IVF specifically, it's really important to put this into context, right? The absolute risk of birth defects in pregnancy is not zero. And depending on what source you look at, it's usually quoted to be around 3%. Now, it's important to note this will also vary based on what you define as a birth defect. And this could be things that are very mild, that may be cosmetic, to things that are very severe and that might require surgery and may be life-threatening. In this study, they said the risk of birth defects in the IVF group was about 3.45%. In the general population, we quote about 3%. So yes, the risk is slightly increased compared to spontaneous pregnancies, but the take-home message is that the vast majority of IVF pregnancies, like 97% of them, do not lead to babies with birth defects.
It is not really understood why there might be an increased risk of birth defects associated with IVF. It could be related to the manipulation of the eggs and the embryo that are necessary as part of the ART procedures. It could be related to the medication, to the stimulation. However, it's generally thought that the risk might actually be related to the underlying cause of the infertility as opposed to the ART itself. For example, there have been several studies that found a higher rate of birth defects among couples with infertility who actually achieve a pregnancy without treatment.
There was a study that was published in the New England Journal of Medicine in 2012. We love the New England Journal of Medicine, very fancy, very prestigious journal. This is a study that looked at over 300,000 births from 1986 to 2002 in South Australia. And they looked at the risk of birth defects in spontaneous pregnancies versus pregnancies achieved with ART in that prior or current birth, and then in women who had a history of infertility but did not pursue treatment. They found that the risk of birth defects for spontaneous pregnancies in women who had a history of infertility was comparable to the risk of birth defects in babies that were conceived via IVF. This led the researchers to consider that maybe it was the history of infertility that increases the risk of birth defects and not necessarily the ART treatment itself. We've talked a lot about birth defects when babies are born, but I think it's important to address a question that comes up pretty frequently. And that is, does IVF cause autism, or do the pregnancies conceived via IVF have higher rates of autism?
There was a very big study published on this topic. It was titled The Early Autism Spectrum Disorder in Children Born to Fertile, Subfertile, and ART-treated Women. And they actually look at 10,000 ART pregnancies, 8,000 subfertile, and 440,000 fertile pregnancies in the United States, and looked at many different factors and concluded that there was no increased risk in autism between women that conceive through ART, women that have subfertility and conceive on their own, or women that don't have any fertility issues and do not require ART at all. This is reassuring that infertility, subfertility, or ART do not have any impact on the autism risk. Autism is a complex condition, it's multifactorial, and to my knowledge, it's not very clear what exactly is the cause of autism, but it doesn't seem to be related to fertility or fertility treatment.
Really, the underlying message is that the vast majority of babies born via IVF are healthy. They maybe have a slightly higher risk of certain complications like birth defects. We don't know whether that's the actual fertility treatment or whether it might just be because of maternal or paternal medical history, including fertility history.
Many people know that both of my children were conceived through IVF. And of course, when I was pregnant, I was crazy worried, because anybody that has experience in fertility knows how anxiety-provoking it is to actually be pregnant. And I was worried because everything that led to having them and that feeling like, am I really going to be a mother? Can this really happen for me? I really was not worried about the fact that they were IVF babies, or one of them was IVF, the other one was an ICSI baby. Honestly, I was not worried about the risk of breast cancer or ovarian cancer or autism or birth defects. I was especially not worried about birth defects after the anatomy scan was normal. And of course, yes, I was worried about stillbirth and complications, that basically losing these pregnancies that worked so hard to achieve, but not in the context of the literature, because I knew that the absolute risk was still relatively small.
Mm-hmm. And that's a really good point in the sense that for many patients, it's not a choice of having a pregnancy spontaneously or a pregnancy conceived by IVF, right? That is not the question. That is not the choice that fertility patients are making. For a fertility patient, the choice is potentially not having a pregnancy at all versus having an IVF conceived pregnancy, if we can call it a choice. The point is that really it's about trying to get to the place where you want to go using what you have available in the way that you can, right? Yes, there may be slightly higher risks in terms of pregnancy complications, but that is the way to achieve the pregnancy and to get to the goal where you want to be.
And a healthy pregnancy is not guaranteed to anyone, regardless of how it is conceived. So we're not talking 0 risk versus 3% risk. Risks are there regardless of how the pregnancy is conceived. So anybody who decides to become parents is taking a risk in how the pregnancy goes and how the health of the baby goes.
With good obstetrical care and with close monitoring, we can mitigate so many of these risks and find these risks, even as you mentioned in the anatomy scan, if there are complications or health issues for baby. The vast majority of these time, these things can be identified pre-delivery so that you have a really good plan in place at the time of delivery to manage any issues or problems.
We hope that you found this useful and that you now feel reassured that fertility treatments would not increase your risk of cancer and that most babies conceived through these amazing treatments are healthy. Stay tuned for more on IVF.
And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast, or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.